Suggestions for public healthcare. Public healthcare must be in operation by citizens. Seongnam City Medical Center, which was formed through a civic movement. Moon Jung-joo, doctor, public health researcher. Congratulations on the opening of Seongnam Citizens Medical Center. Many people are paying attention to this medical center because seeds made by civil society were the driving force behind the opening. This is because it is the first case of creating a public hospital through a long struggle by citizens. Seongnam Citizens Medical Center is a hope in itself. There are many areas where medical inequality is severe in areas or regions without public hospitals in Korea. But the civic movement for establishing hospitals has not been successful for a long time and has expanded its participation. Waiting for citizens who have worked hard has been a number of difficulties. And it has become a difficult wall for local councils and local governments to overcome. In the meantime, the success of opening Seongnam Citizens Medical Center is a hope for many regions. Korea's medical care is becoming more profitable. Our country's medical care has developed remarkably over the past few decades. Compared to the past, the number of doctors has increased significantly, health insurance is provided to all citizens. And there are university hospitals in major cities to provide advanced medical care. Medical use is also very active. And the number of outpatient treatments per population is the first among OECD member countries, and the number of hospitalized beds per population or the length of inpatients staying in the hospital is also the first or second place. But on the other hand, we are unfortunately anxious about our health. Nearly 70% of the population think their health is bad, the highest among OECD members. It wasn't like that from the beginning. In the early 2000s, about 50% of the respondents said their health was bad. But since 2014, it has increased to nearly 70% and has not decreased for several years. In light of the statistics that medical use is the most active in the world, it reveals that there is a problem with medical care in Korea due to unconvincing incongruity. The problem is the commercial tendency of healthcare. This stems from the state neglecting its responsibility for public health and leaving medical care to private hospitals and markets. Private hospitals have grown and developed, but at the same time, the problems that arise there have also grown. Private hospitals are absolutely profitable. For profit, non-payment medical products are developed to escape the control of health insurance and encourage excessive medical care and medical abuse. It invests in expensive spinal and joint surgery, heart disease treatment, plastic surgery, and medical checkups, but reduces or closes non-money emergency, delivery, neonatal treatment, infectious disease treatment, and rehabilitation treatment. The problem of commercial healthcare is getting worse year by year. Above all, the regional focus of medical institutions has intensified. And 60 cities and counties across the country have no medical institutions for mothers to deliver as of 2016. And 4 million people have no access to hospitals or are restricted because they cannot pay health insurance premiums due to pay health insurance premiums. Commercial healthcare is widespread, and expensive tests, expensive treatments, and overtreatment seem to be better. In addition, it is difficult for all medical institutions to share roles or adjust functions in a competitive relationship. And the inefficiency of not cooperating with each other is high. There are many criticisms of such commercial healthcare, but there is little way to keep it in check and lead to change. Citizens must participate in planning and operation as a whole. Seongnam Citizens Medical Center is a municipal public hospital. Respond to the expectations of citizens and meet the needs of the region. Seongnam Civil Society has been working together for more than 10 years to establish a city hospital because it wants to create a hospital that is faithful to essential medical care, not to profit logic, and a hospital that values citizens' health more than economic calculation. Seongnam City also built a municipal hospital with a budget of more than 200 billion won. Because it has a big goal of resolving medical inequality in the region and raising the health level of citizens. Citizens must join in achieving such wishes and goals. Citizens must participate in business planning and operation as a whole. Civic participation is fundamental to a democratic society, but it is especially urgent in the health and medical field. This is because healthcare is an essential condition in life for everyone, so it should be provided according to various aspects of life such as age, housing, income, isolation, and disability. To this end, there must be proposals, cooperation, dissemination, surveillance, and evaluation of the citizens involved. European welfare states are active in self-governing activities involving citizens. Citizen participation is considered a natural right not only in local administrative autonomy but also in the medical field. Accordingly, a committee is formed as a citizen representative at each stage, including the central government, state government, region, and hospital, and participates in the establishment of medical project plans, evaluation of results, and civil complaints management. In Korea, there were traditional village autonomy such as Hyangyuk and Dor, but it was mostly destroyed in Japanese colonial era, and after liberation. Local autonomy began only after the military dictatorship blocked it and achieved democratization. Perhaps because of the long disconnection, the implementation of grassroots democracy in the region is still limited. And this environment makes it difficult to establish public hospitals and makes it difficult for citizens to participate in the operation of hospitals. Fortunately, however, local medical centers have a foothold for civic participation. The first way for citizens to participate in the operation of local medical centers is through the Board of Directors. The Board of Directors is the highest level decision-making structure that sets articles of association to corporations, recommends heads of institutions, approves business plans, and deliberates and resolves property acquisition and organizational changes. As the Local Medical Center Establishment and Operation Act requires a director representing citizens, Article 8. All local medical center boards have at least one director recommended by nonprofit private organizations and consumer organizations and at least one representative director of local residents. This is an important participation system that is currently only in local medical centers, not in the National University Hospital, the largest public hospital. In addition to this, I hope that citizens will participate in the audit committee in the future. Auditing is an activity or organization that represents citizens who are the ultimate owners of public institutions, which oversees financial transparency, supports ethical management, and prevents corruption to promote the integrity of public officials. The National University Hospital has a standing audit and audit office, and the local medical center has a non-executive audit and audit team. But there are few opportunities for citizens to participate. Citizens' participation in the board of directors, civic committees, and even audit activities of local medical centers should be actively conducted. For the health of the Seongnam citizens community. Life and health are essential conditions of life for everyone. However, health is something that no one can be healthy by themselves and must be protected jointly. When citizens participate in the operation of public hospitals, they can strengthen the publicity of medical care and change the reality dominated by profit logic. We hope that Seongnam Citizens Medical Center will strengthen its operating system that accepts citizen participation, and through this, it will serve as a bastion to protect the health of the community.